name's Michael Hunley. This is the IV push skills checkoff. The paper I have in front of me is going to be our order set from our provider. There's nothing on the back. Perfect. All right, so the first thing I'll do is check my MAR and read over the order that I've been provided, which in this case is Lasix 20 milligrams IV push now. The next thing I'll do is check my 5 medication rates, which are going to be the right dose, patient, route, time, and dose, patient, route, time, medication. So the next thing I will do is hand hygiene. After that, I will check my 2 patient identifiers on our patient's wristband, and I will compare them to the MAR. Make sure I got the right patient. After that's done, I'll just put some gloves on real quick, and also prepare 2 saline flushes. And while I'm checking the patient identifiers, I'll also check for allergies. I forgot to mention that. So I'll prepare 2 saline flushes. I've already done so before, so those are ready to go. At this point, I'm ready to administer my medication, or at least draw up my medication. So the first thing I will do is pull back 2 milliliters of air into our medication syringe. I'll remove the tip of this, and I will clean the top of my vial. Since our order set is 20 milligrams IV push now, this comes in 10 milligrams per milliliter, so I will draw up 2 milliliters to get the 20 milligrams. I'll first inject the air into my vial and draw up 2 milliliters.
Okay, this is my hand. The rate of it administration.
Okay, so I have my 2 milliliters of Lasix drawn up. So I will recap that without using my hands here. Perfect. So now that that's done, I can set that off to the side. Next, I will come up to my IV site. I will remove my lock. Okay. I will clean my injection site, and while I'm doing this, I will also check for signs of infiltration or infection at my IV site. I will unclamp. Okay, and I'm trying to maintain a clean saline lock at this point. Another thing I forgot to mention is while I'm cleaning the site, we should do that for at least 10 seconds. So I will attach my saline lock. I will inject 2 to 3 milliliters, like so. Alright, that's good. I will then clean my site again for about 10 seconds. At this point, I still have a clean saline lock. Remove my needle from my syringe. I will inject my Lasix, 20 milligrams IV push, which is 2 milliliters. I will inject that over a minute. For the sake of the video, I'm just gonna say I've injected all of it, but I will inject that over a minute. I will then flush again with 2 to 3 milliliters of saline. All right, good. I'll clean again. I'll assess the patient. I'll recap my IV site and re-clip my IV. At this point, I'll assess the patient, make sure there's nothing crazy going on, remove my gloves, and perform hand hygiene. And lastly, I will document my medication administration in the MAR. Thank you.